All right, good morning, and thank you for joining us for the Stroke Team-Based Care Request for Proposal information session. My name is Jamie Carlson, and I am the CVH and Stroke Community Clinical Planner for the Cardiovascular Health Unit and Stroke Program at the Minnesota Department of Health. Here is our agenda for today. We'll begin with the stroke program history, then talk about the details for the grant request for proposal, funding and project dates, and who is eligible to apply. After that, we'll close with the process to submit your application and how to submit any questions you have. Now I'll hand it over to my colleague, Nikki.
Thank you, Jamie. And hi, everyone. My name is Nikki Anderson, and I'm the director for the Minnesota Stroke Program here at Minnesota Department of Health. To get started, we'll share more about stroke in Minnesota and the history of our program. Stroke is the fifth leading cause of death and one of the leading causes of disability. And while most strokes are not fatal, stroke survivors are often left with disability and/or reduced functional status after their stroke. This also means that stroke survivors often have unmet needs for medical, physical, and social supports while navigating life after stroke. Meeting the needs of stroke survivors, as well as preventing recurring strokes, is an important component of addressing the burden of stroke in Minnesota. Many Minnesotans are at risk for stroke. In fact, hypertension is a leading risk factor for stroke occurrence. And in 2021, 29.5% of Minnesotans reported having hypertension. Now, the Minnesota stroke system has deep roots that trace back to the early 2000s. And we've worked on many different strategies with many different partners throughout our history. We were first funded by the CDC Paul Coverdell National Acute Stroke Program in 2007, and we are currently fortunate enough to be one of the funded states to continue to work on initiatives within the Paul Coverdell National Acute Stroke Program. By addressing each of these four quadrants on the screen, such as stroke hospital designation in the Stroke Learning Collaborative, acute care, and the EHR data collection and quality improvement section, support services for stroke survivors, and prevention and awareness, the Minnesota Stroke Program demonstrates commitment to reducing the burden of stroke in the state by raising awareness in the community, providing continuing education, and working to improve the entire system of care for stroke patients. Diving deeper into the MDH Stroke Program, Minnesota designation supports a comprehensive approach to working across the entire care continuum. We provide resources, network connection opportunities, a robust data collection platform, individualized technical assistance, training and workforce development opportunities, and facilitate learning collaboratives and statewide quality improvement initiatives. Through designation, we ensure care is being provided routinely in line with current evidence-based guidelines. The system is voluntary, and we support programs to increase their internal capacity to not only assess, diagnose, and treat stroke effectively, but to also keep their community members close to home and admit patients locally. We will now highlight some key information located within the RFP. And please note that all information shared comes directly from the RFP documents. Please review those documents for complete information about the grant program and application process. Today, we'll cover some key information from the RFP, but we will not cover everything. So make sure you review the RFP in full for complete details. The focus of the RFP is increasing or enhancing the use of team-based care workforce to improve communication, coordination, and collaboration in the care of individuals at risk for stroke and stroke survivors. So who counts within team-based care? We are asking applicants to engage healthcare professionals, the community-based workforce, such as CHWs, social workers, patient navigators, pharmacists, and then the individual who's experienced a stroke or are at risk for stroke in both healthcare and community settings. Team-based care uses a multidisciplinary team with shared goals to improve the quality of care in both healthcare and community settings by improving communication, coordination, and collaboration among the care team. This team, once again, usually includes healthcare professionals, community health workers, care coordinators, patients, and families, and amongst many other team members as well. And when we talk about the stroke continuum of care, this describes the journey of a stroke survivor from initial prevention and diagnosis to treatment, rehab, and ongoing management. Seamless transitions between stages are ideal, and partnering and collaborating across the care continuum, including partnerships with EMS, clinics, hospitals, rehabilitation programs, and/or community organizations, help to provide coordinated and consistent care, ensuring optimal health outcomes. So here are some examples of themes in which key areas of work that you could do. Implementing technology, standardizing processes and procedures, enhancing interdisciplinary team collaboration and communication, transitions of care, and community-based coordination. We are seeking partners with experience in stroke prevention, management, and treatment who can reach communities impacted by stroke. Applicants must serve at least one focus population or geographic priority area stated. And these populations are overlapping and intersecting, and reaching individuals who belong to multiple target groups is a priority. So, for example, these 4 communities include working age stroke patients aged 18 to 64 and adults with hypertension, stroke survivors with unmet rehabilitation, social support, and social determinants of health needs after stroke, Minnesotans living in rural communities or counties with high prevalence of stroke and hypertension and high social determinants of health burdens. And lastly, individuals living in cities and towns and tribal nations with high burdens of stroke and stroke risk factors. Next, we'll talk about funding and project dates. So this grant includes funding for 1 year at $15,000 with a potential extension up to 3 years. The estimated number of awards is 2, and there is potential for negotiation of the budget. No match is required for funding. As far as dates and timelines, the RFP was released in August. The last date to submit RFP questions is Monday, October 6th. All proposals are due October 15th. Notice of funding decisions will be made in November, and the grant work will begin in January of 2026. And once again, the project period will end in January 2027 with the possibility to extend 2 years based on the availability of funding. And now I will turn it back over to Jamie.
Thank you, Nikki. I will start off by talking about who is eligible to apply and collaboration with partners to address team-based care. Eligible applicants may include, but are not limited to, clinics or healthcare organizations, community-based organizations, community health boards, local public health, nonprofit organizations, faith-based organizations, tribal governments, and social service organizations. Applicants are required to work across parts of the stroke continuum of care with a team-based care approach. Letters of support from partners are required if your organization is collaborating with an outside organization. There will be a spot in the REDCap application for you to upload any letters of support that you may have. If you are not partnering with an outside organization, a letter of support is not required. A single application should be submitted on behalf of all partners in the collaboration, with one organization identified as the lead. That organization, along with completing the grant duties, will be the fiscal agent to receive and manage the grant funds. We invite applicants to learn about Minnesota's action plan to address cardiovascular disease, stroke, and diabetes 2035 plan. These grant funds are designed to support activities that are in alignment with the goals in the Minnesota 2035 plan. This plan is meant for all Minnesotans, organizations, and individuals to draw inspiration from the plan's goals, intended outcomes, and strategies. We encourage you to draw from the plan to design your work plan approach. There are also many tools available to help you and your partners engage with the Minnesota 2035 plan and content in different ways. The link at the top right will take you to the plan website with interactive menus highlighting 10 outcomes, numerous strategies, and different actions to take. The website also features success stories and other resources for communities to promote the plan. So after the grant agreement is executed with the awarded grantee, Here are some of the activities that you'll participate in. Work with MDH to revise and finalize the work plan and budget, assign a staff person to serve as a primary liaison, submit progress and annual reports, participate in regular check-ins, collaborate with MDH staff to develop an evaluation plan, and participate in the Stroke Learning Collaborative. Now I'll go into describing the application process and instructions for the REDCap platform for submitting your application and required documents. Here's an overview of the scoring criteria that we'll be using. The scoring system is out of 55 possible points. So the applicant profile and project team is worth 10 points. The project description and goals are worth 10 points. Stroke care continuum and priority population questions are worth 10 points. The Minnesota 2035 plan question is worth 5 points. Evaluation and data worth 10 points, and work plan and budget is worth 10 points. We strongly encourage you to score your own application prior to submitting it. You must submit the application through the REDCap link along with the 2 required forms into REDCap for your application to be considered complete. The 2 documents that are required to submit with your application are the due diligence review form and the applicant conflict of interest disclosure form. These 2 forms are available on the RFP webpage, in the RFP document, and in the REDCap form. Once again, applicants who are proposing to collaborate with an outside organization are required to include letters of support from each of the agencies listed as partners on the application. Please note that these letters of support should be included in the application submission form. Should be included in the application submission from the lead organization and not submitted separately by partner organizations. We will only accept applications submitted via REDCap. This REDCap link is a public link, so you will not be required to register or create a username and password. The instructions to complete the application can be found in the RFP and REDCap application. The instructions for the application include completing all required fields marked with an asterisk, uploading all necessary documents in the designated sections, and you may save your progress and return later by selecting Save and Return Later button. Once submitted, you will receive a confirmation email with a copy of your responses. The final date to submit your application is Wednesday, October 15, 2025. Please plan ahead and do not wait. If you are having any technology issues when submitting your application, please contact health.stroke@state.mn.us and we will get back to you as soon as we can. So when you go to click on the REDCap Stroke Team-Based Care Application link, it will bring you to the program overview page with information found in the RFP. Following the program overview, you can find the priority population descriptions and scoring rubric. After the scoring rubric, you will begin the application. The application begins with the organization and contact information page. This includes uploading the due diligence form and application conflict of interest disclosure form. Following this, you will fill out the answers to the application questions with the work plan and budget completed last. You can move forward or backward by clicking the next page or previous page buttons. If you need to stop the survey and return at a later time to complete it, you will need to enter your email address to receive the link to your email inbox. The email will come from REDCap Administrator. You can save and return later at any point in your application. So here's what the work plan and budget look like in REDCap. We ask that you fill out these for the grant year. The goals you will fill out in the application question will transfer over to your work plan shown on the left of the screen. The grant budget template in REDCap is shown on the right of the screen. The project total will automatically calculate for you. If you do not have any expenses in a category, please input 0 under the total for that category. The total amount will display in red text, but this does not indicate an error. Once you submit your application, REDCap automatically sends all applicants an email to inform them the application was received after submission. The email will include a copy of your responses. All applicants will be contacted via email by November 2025 with their award status and, if funded, the amount of funding. The application review and selection process will be completed by a committee representing content and community specialists with specific knowledge of stroke team-based care, as well as some MDH staff. The review committee will evaluate all eligible and complete applications received by the deadline. Please submit any questions you have to the health.stroke@state.mn.us email address. We will respond to you within 3 business days. The question and answer page located on the MDH Stroke Grant Funding Opportunities page is where all questions and answers will also be posted. Please submit questions no later than 4:30 p.m. Central Time on Monday, October 6th. And we want to close today by thanking you for joining us for today's Stroke Team-Based Care RFP information session. We hope to see your application, and if any questions do come up, please send us an email to health.stroke@state.mn.us as seen on the screen. We hope you have a great rest of your day.